My name is Sang Lee. I'm a professor and the chief of colon and rectal surgery at USC. I'm board certified in general surgery and colon and rectal surgery. Our mission here at USC is to provide compassionate, innovative, and the state-of-the-art care for all aspects of colon and rectal diseases. What sets us apart from other institutions is that we have a strong focus on providing minimally invasive care and treatment for complex anorectal and colorectal diseases. We perform almost all of our initial colorectal cancers and colorectal diseases using laparoscopic methods, avoiding large scars and incision in the abdomen for the patients. This allows the patients to stay in the hospital for a shorter period of time, much better outcomes, and patients are able to go back to work much quicker. We also pioneered a technique called CELLS. It stands for Combined Endolaparoscopic Surgery, which allows us to remove large benign colon polyps that cannot be taken out using colonoscopic methods. By combining laparoscopy and colonoscopy, we're able to completely remove these polyps without performing a bowel resection. So typically in this country, almost all of these patients will undergo colectomy, removing significant part of the colon. And if you're lucky, 50%, you will undergo laparoscopic colectomy. But even with that, there's a significant morbidity associated with the procedure. So using a CELLS technique, we're able to remove the polyp completely without performing bowel resection. The difference is that these patients go home on the same day as opposed to about 5 days of stay in the hospital after laparoscopic colectomy, and they're able to return to work in days compared to weeks after laparoscopic colectomy. We also provide multidisciplinary approaches to caring patients who present with complex colorectal disease processes. Patients who present with, for example, inflammatory bowel disease, colorectal cancers, patients have best chances for a cure, and to avoid even permanent colostomies result from having an input from other specialties. We're fortunate enough to have a world-class experts at Norris Cancer Center here, also Inflammatory Bowel Disease Center. So with collaboration, we provide the best outcomes for the patients. So our division has strong focus in providing minimally invasive treatment for all aspects of colon and rectal diseases. For example, for common anorectal disorders such as hemorrhoids, anal fissures, and fistulae, we are able to provide much less painful and much less invasive treatment for these, so that patients have significantly less morbidity and they're able to return to work much quicker compared to traditional methods. We also provide minimally invasive or laparoscopic approaches to very complex colorectal diseases. So we perform greater than 90% of our initial patients who present with a colorectal diseases laparoscopically. And laparoscopic surgery also has long-term implications as well. Patients may have a significantly less long-term complications such as small bowel obstructions after laparoscopic surgery compared to open surgery. Our division is a forefront of offering state-of-the-art innovative approaches. One method that we are very active in is to provide robotic surgery and endoluminal surgery. We are actively researching ways to completely avoid bowel resection by using endoluminal surgery. We're working with industry to develop a endoluminal robots that allows us to perform very complicated procedures such as removing benign growths, early cancers, and perhaps in the future treat diverticulitis without removing part of the colon altogether. So we don't practice other general surgical procedures. We just practice colorectal surgery. In this country, average general surgeon probably performs less than 5 colon surgeries a year, where colorectal surgeons here perform 50, 100 colon surgeries per year. So we have a special training in caring for patients using laparoscopic, minimally invasive techniques, but we're also board certified, and we have a specialty training in caring for patients with the colorectal disease issues. Our institution, our division, have much better outcome with respect to surgical site infection, much shorter length of stay after colon surgery. We also have a significantly less readmission rate. So all of this translates to expertise and providing the best possible outcomes for patients who present with colorectal diseases. So I think patients really should seek out an expert help as opposed to accept a generalist, general surgeons who occasionally perform these procedures. So I think it's very, very important that patients seek out expert help in order to have the best possible outcome. My hopes for the future of the department are continue to provide excellence in patient care and provide innovative approaches through research and collaboration with other institutions and industry to come up with even less invasive and even more effective treatment for patients who present with colorectal diseases.